at an edge of it.
Dr. Perry, you were called into the emergency room. Just what did you do? What did you see?
Immediately on arriving in the emergency room, I noted that the President had received a lethal wound. He was at that time under the care of Dr. James Carrico, who initially saw him as he entered the door. I was there approximately a minute or two later. There was no evidence to my attention of heartbeat or pulse, but he was attempting agonal respiration. I noted a wound of his neck and of his head, the latter being a quite massive wound. At that point, I started a tracheostomy to assist his respiration.
Did the President have a chance at all when he was brought in?
No, sir. In my opinion, the wound was a mortal one, and his chances of survival were none.
There were 2 bullet wounds that you saw.
There were 2 wounds. At the time, I could not tell for sure whether they would possibly have been made by 2 missiles or 1. It was my impression that there were 2 distinct wounds, one of the neck and one of the head.
And these were large, massive wounds.
The wound of the neck was a small, penetrating wound and appeared to be the entrance wound of one of the missiles. The wound of the head was a quite large wound, could have been either an exit wound or a tangential wound of the skull.
Could the President could he have been in pain and realized this?
No, the President was completely unresponsive throughout the entire time that I was attending him. I don't think that he even perceived the impact of the bullet at all.
How long did he live after you saw him?
Time becomes quite compressed in such a situation, and I could only estimate, and I really don't know. I was quite busy at the time. I didn't consult a watch, and I was summoning Dr. Clark and Dr. Baxter McClellan for assistance, and was very busy at this time.
How many doctors in all were in attendance?
I would estimate 8 or 10. I don't know exactly. Everyone began arriving very shortly after I sent for help, and we were doing the tracheostomy, and Dr. Baxter McClellan arrived, Dr. Clark, and Dr. Jenkins to assist with the oxygenation, and subsequent to that, other physicians came too.
Were there other members of the President's party in the room or close by?
Mrs. Kennedy was there when I arrived, and as far as I know, she was there doing most of the time in the room. She was outside part of it, I think, but I was quite busy, and I didn't notice if she left.
Did you have a chance to view her as far as her composure and so forth?
Yes, and I must say that on several occasions I did see her. She was well-controlled, quite composed, and I thought she acquitted herself quite well as befits the First Lady, and she was magnificent.
For all purposes, the President actually was dead when the bullets struck him.
For practical purposes, that is correct.
Doctor, the time they set for 1 o'clock when the President died, did that be verified?
The President's death was pronounced by Dr. Kemp Clark, Chief of Neurosurgery, and as I said, I did not have the opportunity to consult a watch. I was busy with resuscitative measures, and I just couldn't be sure about the time myself.
Doctor, I know all the doctors did all they could to help the President. Does this happen often here?
We have a very active trauma service, and this is a team effort in all instances. What I did and what the remainder of the team did is something which we're faced with quite often. I would emphasize that, as always, it requires numerous members, and I think each of them did all that was possible.
No, I know.